Gender dysphoria represents a complex psychological condition characterized by significant distress arising from incongruence between an individual's experienced gender identity and their assigned sex at birth. This phenomenon manifests distinctly across different developmental stages, with adolescents and adults experiencing unique challenges and manifestations that require specialized understanding and therapeutic approaches. During adolescence, gender dysphoria often emerges or intensifies as young people navigate the tumultuous period of identity formation and physical development. The onset of puberty can trigger profound distress in adolescents experiencing gender dysphoria, as secondary sexual characteristics develop in ways that feel fundamentally misaligned with their internal sense of self. This developmental stage presents particular challenges because adolescents are simultaneously grappling with normal identity exploration while experiencing the acute discomfort of bodily changes that feel foreign or distressing. The social pressures of adolescence compound these difficulties as peer relationships, romantic interests, and social expectations become increasingly gender differentiated. Adolescent gender dysphoria manifests through various behavioral and emotional indicators. Young people may express persistent dissatisfaction with their physical appearance, particularly focusing on gender-specific bodily features. They might engage in binding behaviors, avoid mirrors, or experience significant anxiety about using gender-segregated facilities like bathrooms or locker rooms. Social withdrawal often occurs as adolescents struggle to navigate environments where gender expression feels constrained or inauthentic. Academic performance may decline due to the cognitive and emotional resources devoted to managing dysphoric feelings. The diagnostic criteria for gender dysphoria in adolescents require persistent incongruence between experienced gender and assigned sex for at least 6 months, accompanied by clinically significant distress or impairment in functioning. Mental health professionals must carefully differentiate between gender dysphoria and typical adolescent identity exploration, considering factors such as the persistence, intensity, and associated distress of gender-related concerns. Adult gender dysphoria presents different, but equally significant challenges. Adults may have lived with gender dysphoria for extended periods, having developed various coping mechanisms or suppression strategies throughout their lives. Some adults experience late-onset recognition of their gender dysphoria, particularly as societal awareness and acceptance of gender diversity has increased. Others may have been aware of their gender identity from childhood, but suppress these feelings due to social or familial pressures. Adult manifestations of gender dysphoria often involve sophisticated psychological defenses and adaptation strategies. Adults may have constructed entire life narratives around their assigned gender, including careers, relationships, and social identities that feel increasingly inauthentic. The decision to address gender dysphoria in adulthood frequently involves complex considerations about existing relationships, professional obligations, and social standing. Many adults describe a gradual intensification of dysphoric feelings over time, reaching a point where continued suppression becomes psychologically unsustainable. The therapeutic approach to gender dysphoria varies significantly between adolescents and adults. For adolescents, treatment often involves a multidisciplinary team including mental health professionals, medical providers, and family therapists. Interventions may include individual psychotherapy, family counseling, social transition support, and potentially medical interventions such as puberty blockers or hormone therapy, depending on individual circumstances and clinical guidelines. Adult treatment pathways typically involve comprehensive psychological assessment followed by individualized treatment planning. This may include psychotherapy to explore gender identity, develop coping strategies, and address co-occurring mental health concerns. Medical interventions for adults might encompass hormone replacement therapy, surgical procedures, or other gender-affirming treatments based on individual needs and preferences. The social context surrounding gender dysphoria significantly impacts both adolescents and adults. Supportive family environments, inclusive educational or workplace policies, and access to knowledgeable healthcare providers can dramatically improve outcomes. Conversely, rejection, discrimination, or lack of appropriate resources can exacerbate distress and increase risks for mental health complications. Research indicates that appropriate treatment and social support can significantly reduce the distress associated with gender dysphoria. Long-term studies suggest that individuals who receive affirming care and support experience improved mental health outcomes, reduced anxiety and depression, and enhanced overall quality of life. However, the complexity of gender dysphoria requires individualized approaches that consider each person's unique circumstances, support systems, and treatment goals. Understanding gender dysphoria in adolescents and adults requires recognition of its multifaceted nature, encompassing biological, psychological, and social dimensions. Effective intervention demands comprehensive assessment, culturally competent care, and ongoing support throughout the individual's journey toward authentic gender expression and psychological well-being.